Let me overview few board question with answer. The first question here, a nurse is instructing a premenopausal woman about the breast self-examination. The nurse should tell the client to do her self-examination. What should tell? Number one, at the end of menstrual cycle, on the same day of each month, on the first day of the menstrual cycle, and number four, immediate after her meals. So it is very important to self-examination of the breast to find out any kind of tumor or abscess or any medical condition. But what is the suitable time to check? Right? Is it the first, end of the menstrual cycle, or same day every month, or on the first day of menstrual cycle, or immediately after her means? So according to this, they said that it is immediately after our menstruation period. Why? What are the rationale? The premenopausal women should do their self-examination immediately after the menstrual period, when the breasts are the least tender and least lumpy. On the first and last day of menstrual cycle, the women's breasts are still very tender, or post-menopausal women, because of their body's lack of fluctuation of hormonal level, also should select one particular day of the month to do the breast self-examination. So this question about the premenopausal women. So premenopausal women, particularly, they have a lack of estrogen or progesterone level. So we said here it is a good time to examine the breast immediately after her menstruation period. Right? So because what are the reason and why we should do that times? Right? So because they said in that times the breast is least tender and least lumpy. But question sometimes comes, how we know that the female at the premenopausal states? So how do you know? If you have any persistent change of several days or more in the length of patient menstrual cycle, or if maybe in the early premenopausal. So in that case, it is important to same day, but immediately after stop the menstruation. Second question here, a client with metastatic brain cancer is admitted to oncology floor. According to the Self-Determination Act 1991 concerning the execution of an advanced directives to the hospital is required for. So here this question, keyword, patient have a brain tumor, admitted oncology department. So now question come about advanced directives, right? So in case of advanced directives, what we could do? So the first option, decide on a treatment plan if the client cannot, inform the client or legal guardian of their right to exclude an advanced directives, respect individuals' moral rights, and also advise the client not to exclude their advanced directives because they limit the treatment option. So this question regarding the advanced directives. So what is advanced directives? We have to know. So advanced directives are the written instruction recognizing under the state of law that are related to provision of care of a person or care of the person wishes to have when she or he cannot make the decision themselves. Like a patient is very bad medical condition going to unconscious. When patients are not able to take the decision on behind of them, who take the decision? So it is the written consent that in absence of my opinion, that person do that decision on behalf of me. It is maybe living will or durable power of attorney or healthcare proxy. So out of the four options, what is you prefer, right? They said inform the client or legal guardian of their rights to exclude an advance directives. So in absence of me, they can take the decision. Keep in mind, living will or durable power of attorney and advanced care medical directives absolutely not same. Like living will means prepared by a component adult or giving the health care direction in the case when the person is unable to make a decision on their own. And durable power of attorney means document that specific who will make your healthcare decision if you are not able or if you cannot. And advanced care medical directives means it is a component or competent the client consultant with healthcare provider, also specify the kind of medical care they do or do not want in specific scenario. So what is their rationale? The Client Self-Determination Act 1991 require all healthcare facilities to notify clients upon admission on their right to exclude and advance directives. The facility ethics committee can decide on the treatment plan if the client is unable and healthcare power of attorney has not been appointed. Hospital employees are not required by law to request an individual moral rights. However, the healthcare professional should respect the client individual rights as the part of his professional responsibilities. The healthcare profession are sometimes concerned that advanced directives prevent the treatment that might help the client. However, the hospital is not required to advise the client not to exclude their advanced directives. But next question. So here's something more. What is advanced directives and what is healthcare power of attorney? They said advanced directives means it is a documented, written or verbal instruction by the client about his wishes for life-sustaining medical care in events he becomes incapacitated. For example, living will, healthcare power of attorney, or any document that state the client wishes. So advanced care medical directives, it is the competent client, consultant with healthcare provider and specify the kind of medical care they do or they do not want in specific scenario. What else? The healthcare power of attorney. Let me read it. It is a legal document in which the individual designated another person and called attorney in fact or act on the individual behalf if the principal person becomes disabled or incapacitated. That document becomes void when the principal person die or recover. So durable power of attorney, or we can call healthcare proxy. It is the document that specify who will make your healthcare decision if you cannot. Next question. A client tells the nurse that she has found a painless lump on her right breast during her monthly self-examination. Which assessment findings would strongly suggest that the client's lump is cancerous, right? So out of 4 options, which one support the lump is a cancer, they say. Number 1, eversion of the right nipple and mobile the mass. So if any mass is mobile, it is not cancer. It is always benign. Non-mobile mass is irregular as. So the question number 1, mobile. I said if it is mobile, is not a cancer. So what are the opposite of mobile? Means fixed. So if anything is fixed, non-mobile, irregular, it is strongly support cancer. Let me recap it. If any mass tumor is non-mobile or fixed, irregular as, and painless, it is always support for cancer. Number 3, mobile mass. No, we already said not mobile, soft, easily delineated, or non-palpable right axillary lymph node. Non-palpable means lymph node is not palpable. So if anybody has a cancer, lymph node must be palpable. So we support the answer is 2. So non-mobile mass, irregular as. Rational said breast cancer tumor are fixed, hard, or poorly delineated or demarcated or irregular edge. A mobile mass that is soft and easily delineated is most commonly fluid-filled benign cyst. Mobile is benign cyst. Axillary lymph node may or may not be palpable at the initial detection of a cancer mass. Nipple should be retraction, not eversion. Nipple should be inside, right? It is called retracted nipple. But when nipple is ejaculated, this is the outside. It is called everted, right? But it is not everted, not eversion. Maybe sign of cancer. Next question here. A client with laryngeal cancer has undergone laryngectomy and is now receiving the radiation therapy to the head and neck area. The nurse should monitor the client for what adverse effect of external radiation. So this question, we can see the patient has a laryngeal cancer and patient is undergo to the therapy and it is radiation therapy. So question comes, if patient had radiation therapy, monitor the client for which adverse effect of external radiation. Select all type. First of all, xerostomia or stomatitis, thrombocytopenia, cystitis, or dysgenesia, and also leukopenia. So there are 6 options. We have to choose the correct answer that are the adverse effect of external radiation. The first one is called xerostomia. Xerostomia means dry mouth. And dry mouth can have the cause that are not due to the underlying disease. So it is the one of the adverse effect of radiation. Stomatitis. It is means oral mucositis. Stomatitis is a condition that causes the painful swelling and sore inside the mouth. Stomatitis may be causes by a disease, maybe causes infection, allergic reaction, or irritating food, or any chemical or radiation. It is also the adverse effect. Thrombocytopenia means platelet go down. It is not a cause. Cystitis, infection in urinary bladder, it's not a cause. And number 5, they said dysgeusia means it is altered the taste. It is altered or impaired the sense of taste. Altered the taste can have the cause that are not due to the underlying disease. And alter the taste also the cause of external radiation. Last one is leukopenia, WBC go down. It is not a cause. What is their answer? They said xerostomia, stomatitis, and dysgeusia means alter the taste. What is their rationale? Radiation of the head and neck commonly produced by dry mouth. It is called xerostomia. Irritation of the oral mucous membrane. It is called stomatitis, or diminish the sense of taste. Thrombocytopenia means reduce the platelet, or leukopenia, reduce white blood cell count, may occur with systemic radiation. Cystitis may occur with radiation of genitourinary system, but this patient is the head and neck area. So head neck area is related to mouth. It is related to the taste, right? So it is involved in the upper head neck areas. Next question here. A registered nurse on oncology floor is busy with another client. So the nurse delegate care of a client to her co-worker. A licensed practical nurse, LPN. The client that the LPN begins the caring for require a 3 hours chemotherapy infusion. Which statement is accordance with the Nurse Practice Act? So here, RN delegate a LPN to take care of patient who, a cancer patient who starting the chemotherapy infusion, right? Which statement is accordance with the Nurse Act here? So when the caring require 3 hours chemotherapy, number 1, LPN may administer chemotherapy drugs if the passing the hospital chemotherapy administration course. So it is the delegation and responsibility. So every LPN or RN do not do everything, right? So keep in mind, some of the activities we never, LPN are usually not to allowed to do: perform triage, administer IV chemotherapy. So number 1 is not an answer. Or LPN not allowed to perform central line procedure or administer blood transfusion, right? So 1 is not an answer. Chemotherapy will need to be held until another RN can care for the client. Definitely, it is important. A chemotherapy certified RN must be begin the chemotherapy. This is the best choice. Then LPN may monitor the client. Physician must administer the drugs. So what is the answer? Definitely number 3 is the best option. Chemotherapy certified RN must be choose the chemotherapies. And according to the Nurse Practice Act, the specifically trained RN must begin the chemotherapy infusion. The LPN then monitor the client, which the drug infusion. The Nurse Practice Act state that the chemotherapy drug administration is not within the LPN scope of practice. Chemotherapy administration or administered should not be delayed. It is not necessary for a physician to admin the chemotherapy. So let me recap one more time. So LPN are usually not allowed to do perform triage or administer IV chemotherapy or LPN not allowed to perform central line procedure. LPN are not allowed to administer blood transfusion unless they have satisfactorily completed a transfusion training program meeting criteria specific by the Department of Health and State Education Department. RN must be present for supervision if they need, right? Always keep in mind the LPN what can do. The provide care to the client stable condition, or LPN can perform very basic therapeutic preventive care or rehab procedure. Example, LPN can allow to do sterile dressing change, urethral catheter and NG tube insertion if patients are stable, or application of restraint in under supervision of RN. And also, LPN can assist RN with unstable and complex client, but always supervision of RN.